Evidence-based home visiting programs are an effective early intervention strategy to improve the health and well-being of children and parents. The Georgia Home Visiting Program is a strengths-based, family-centered support strategy that gives pregnant women and at-risk families with children from birth until kindergarten entry to the resources and skills they need to raise children who are physically, socially, and emotionally healthy and ready to learn.
Oftentimes, believe it or not, patients may not be completely comfortable saying that they don't have everything going the way they'd like it to go. A lot of times patients may feel shame, like, maybe I'm not a good mom, or maybe I'm not cracked up for this. And so they may not talk to physicians. And that's another reason why I think having additional community support persons is absolutely vital. There are lots of ways to help implement additional supports into your practice. Home visiting, however, in my opinion, is one of the best. I mean, if you look at some of the other countries, like in the United Kingdom, you will see that people are having home visits, right after their delivery, like 24 hours being home. Someone has come in, checked on them, made sure feeding is going okay, made sure mom is able to move around okay, particularly if she had a really difficult birth or had a cesarean delivery. That kind of care really makes sense because it reduces poor outcomes and it also reduces cost. I spent 5 years in Upson and Lamar counties, and we had a home visiting program in Lamar, which was fantastic. These patients would receive visits from a home visitor. They would have regular, blood pressure checks. They were able to have an opportunity to talk about how things were going at home and have their questions answered. If they were breastfeeding a preterm infant, they were able to get support with that. So there was lactation care as well. And I'm a big fan of having that and connecting people with those resources. And again, I just always encourage physicians to know what's going on in your community, because if you don't know, oftentimes you may miss out and may not have that resource available to offer to your patients.
Research has shown that early interventions are key. Several sites throughout the state of Georgia utilize evidence-based home visiting programs as an effective strategy to improve the health and well-being of children and parents. For more information about the Georgia Home Visiting Program, visit dph.georgia.gov/home visiting.